All right, at 10:03 we can formally begin. Thank you for being patient with the technical issues. Good morning. My name is Lori Beckel, and I'm the Technical Assistance Coordinator at the Pyramid Plus Center. This webinar this morning will be co-chaired by myself. And Connie, would you like to introduce yourself as well?
I can do that, but certainly not under the pretense of co-chairing because you're the content expert. But I'm Connie Carroll Hopkins. I'm providing the technical assistance for the health integration work in the local early childhood councils.
So I think this conversation today certainly will, Connie and I will both be listening for ways that we can support the implementation of the Pyramid Plus work in your communities. And really the goal for today is to have some discussion, really, and that's why I'd like to keep people able to chime in when you have something important to say or a question to ask. So I'd like to keep this open for people to be able to do that. It might be useful if you would just quickly say who it is who's speaking so that Connie and I can take some notes about this. We will want to follow up with you all, though, with some brand new materials that I wish that I had received prior to my sending out the previous benchmarks. As you probably saw, with those benchmarks, they really are focused more on program-wide implementation of the pyramid model. We have just received, as of yesterday, the benchmarks that we really are more interested in the call today related to community-wide implementation. So for everyone on the call today, I will send out these new materials to you, as well as I will be sending out an evaluation form, and really would appreciate your feedback on the usefulness of this webinar. So.
And maybe just as a point of clarification, Lori, do you want to send me that bit of information, and we'll send it out to everybody so that they will look for it coming from me, or do you want me to give you email addresses for the folks who are participating and it comes out from you?
You know, ReadyTalk is a cool little system in that everyone on the call, perfect. I believe I'll have a list. Perfect. Yeah, I can do a group email.
Wonderful.
That will be something I will send out to everyone, but I did want to say to you, Connie, I did send it to you this morning.
I saw that. Thank you.
You also have it. But I think as we work through this today, this new tool actually will be very helpful to you all in your council work and as you think about implementation. All right? So again, I'm wondering if we could just do a very quick review of who is on the call. And if you could say where you're from, I think that's very useful. So, Angela, you said you were from Adams County?
Yeah, I'm Angela Rothermel from the Early Childhood Partnership of Adams County.
And what is your role, Angela?
I'm the director.
Director. Fabulous. And then Cindy Bernal is on from Pueblo. Cindy?
Yes, Cindy and Joanne Trujillo and Sheila Fowler from Pueblo.
Terrific. And Cindy is both the R&R director and the early childhood coordinator down in Pueblo. And I will say that Pueblo is the site that, the community-wide site that the Pyramid Plus Center is currently working with as a demonstration site. So we're in partnership to learn a lot about what community implementation looks like.
We're building it as we go.
We are, aren't we? Debbie, would you introduce yourself again?
Sure. I'm Debbie Becker, United Way of Weld County's Child Care Services Coordinator. So I work under the authority of the Early Childhood Council Promises for Children, but I am the coordinator for the Resource and Referral Agency.
Terrific. Thank you. And Chris, introduce yourself, please.
Sure. Chris Ingram from the Alliance for Kids, which is in El Paso County. I'm the coordinator of the council.
And Mary, how about you?
Yeah, I'm Mary Bowman. I'm with the Loveland School District, and I'm working with the Early Childhood Council here to implement Pyramid community-wide in Larimer County.
Terrific. And Michelle?
Yes, this is Michelle Selecki from the Teller Park Early Childhood Council.
And what is your role, Michelle?
I'm the council coordinator.
So you guys probably all know each other.
Sorta.
but thank you for introducing yourselves to us. It's great. And Sandra Gregory has joined us. Sandra, where are you from?
I'm from Douglas County. I'm the director of the Douglas County Early Childhood Coalition, so I know all the rest.
Terrific. Thank you. And Stacy?
I'm Stacy Severn. I'm the Early Childhood Council coordinator for Yuma, Washington, and Kit Carson counties.
Terrific. And Virginia Kyle is on. Good morning, Virginia.
Good morning.
And would you introduce yourself, please?
I do training and technical assistance through CDE for several communities of San Luis Valley and Gunnison and Paradox, who are rolling out the pyramid model. And I also am doing coaching in Norwood, which is a certifying site. So I'm just listening in, and if I can be of help during the conversation, I will.
So one of the things that I do want to just mention during this call is the certification that the Pyramid Plus Center is doing for both Pyramid Plus coaches and Pyramid Plus trainers. And Virginia is one of the coaches and trainers that is in the 2010 certification cadre. So we can talk about this more later, but I do want to mention that we will be sending out invitations to people who want to consider becoming certified in the 2011 cadre, and those applications are due by the end of May, and we will be then quickly choosing the next cadre and let you know by June 15th, because a required part of that certification is coming to the Summer Institute, which we're having in July. So if you don't have all of your questions about certification answered in this call, feel free to email me, and I can make sure I answer all the rest of your questions. All right. I would like to just very quickly, though, introduce the Pyramid Plus Center to you all. I think that were many of you at the ECLA meeting where Barbara Smith presented the Pyramid Plus Center?
Yes.
Okay.
Yes.
So I'm not going to spend a lot of time with this because most of you probably have been introduced to the Pyramid Plus Center, but the University of Colorado at Denver was chosen from those that applied to an RFP that was out last summer. And the RFP was funded by 3 divisions within the Colorado Department of Human Services. And the RFP was really focused on having a Colorado center that could really support the implementation statewide of the pyramid model and the PAXI strategies for inclusion, as well as to join with our partners with Special Quest. So that really has been what we have been focusing on. This slide just talks primarily about what I did and the approach that we're taking. And again, our approach to training and technical assistance is a tiered approach. so we will have some universal strategies available on the Pyramid Plus website. So anyone can go there and get information about webinars and other tools and supports available for implementation. And that is just www.pyramidplus.org. We have then some targeted strategies, and those will primarily be the trainings that we're doing. Again, information on our trainings is on the website. Actually, tomorrow we're doing our first module training for, I think about 150 people are coming, half for the infant Todd modules and half for the preschool modules. So the targeted strategies have to do with the module training as well as other trainings we're doing through the R&Rs and then through through webinars. And then our kind of most intensive way of providing technical assistance really is through our certification. So, anybody have any other questions about the Pyramid Plus Center before we start talking about community-wide implementation? No? All right. So I think what I'd like to do, if we could here, is as we go through these slides, it's really an opportunity for you all to share some of what's happening in your community related to these critical elements of implementation and what's working. So we hope to learn from each other about where you are in your implementation and what's working in each of these elements. So we'll be talking about the importance of establishing a leadership team, the importance of creating community buy-in and developing some visibility for your pyramid model implementation, the role of families in implementation, the critical part of their involvement. I have program-wide expectations here, and that really relates to how you are thinking about determining who are going to be some of the demonstration sites in your community, because you really will want to have some ways where people can see the pyramid model approach in action. What your strategies are for training, the coaching, and then at the program level, what are going to be some of the requirements that you have from programs that become involved in your implementation, agreements, plans, and procedures for responding to challenging behavior, inclusion of children with special needs. We do have some non-negotiables about that we can get to as we go on. Professional development and staff support, and then your evaluation plan, how you're going to monitor implementation and outcomes. And you will see that when I send you the community-wide information, it's very similar. They add the important role of identifying a coordinator to work with the leadership team. And they also talk about the importance of funding and having a plan for at least 3 years of funding to be identified. You also want to have sustainable funding, which means that while you might depend on some grants to begin with, grants, as we all know, are not sustainable. And so need to have, and this is again where the community buy-in becomes so important, and that you start having program, school, and center-based teams commit resources if not money, initially, at least time and energy and leadership and those kind of things. But that over time, that's what's going to sustain your efforts. Okay, so could we start by just talking about establishing a leadership team and what you've done in terms of that, what you found has been working well for you in recruiting people for the leadership team, who you think is critical to be on a leadership team. Cindy, would you like to talk a little bit about your leadership team?
I knew you were going to do that, Lori. Yes, I can talk about it. We're doing the pyramid model as a community-wide project and event instead of just individual programs, but we're really opening it up to the community. So for us, our leadership team, it was really critical that we get key people that serve a variety of target audiences in the community, so that we are well represented. I'm the administrator for the team, and then we have four people, I guess, three really, that are going to do coaching with individual programs that have we've received funding from a variety of sources to implement the pyramid model. Two of those are from the R&R, from Children First and the Council. One is from our local mental health agency. She's our early childhood mental health consultant. Then we have our early childhood mental health specialist from our mental health agency that will kind of do a little bit of coaching and some of the training pieces. And then we have our CASA coordinator, which is court-appointed special advocates representative, because she is out there in the community and reaches a different audience than the rest of us do. The rest of us are pretty much primarily early childhood focused. She sees those people not only from early childhood but on up that go through the judicial system, the law enforcement, the courts, and she has seen that there's a huge need, and so she has the audience of judges, attorneys, child welfare, all of that component where children are really in a specified service for a reason. So she's able to get out there and spread the word with those audiences about this so that hopefully down the road we won't see as many children going through that system. So that kind of makes up our leadership team. We've been really intentional about who we've invited, and we intend to grow our team as we get more involved working with the individual programs that are participating, because we feel they need to have representation on the leadership team as well. So that's kind of who we are.
That's terrific, Cindy. Do any of the others of you have your child welfare system engaged?
No, we don't, in Loveland. Loveland,
We
Collins.
sort of do in Weld County, because we have two of the people on our team are Department of Human Services. They oversee the CCAT, but they also are working with the welfare. Not that I'm sorry, I can't think of the right word.
Well, probably the child welfare system, children in foster care and families.
Foster care was the word I was trying to find.
Yeah,
but
involved in that system.
Mm-hmm.
That's terrific.
And then we do also have two members from the behavioral health, as far as the early childhood mental health intervention people, and then the coordinator for the council, and then myself as coordinator of the R&R. That makes up our team.
Yeah, terrific.
And this is Cindy again. I forgot. We do have our Part C person as well on our team. I inadvertently left her off.
Yeah, and because they're such an important funder of the Pyramid Plus Center, Our work really is birth 5, and so we definitely want to encourage leadership teams to have the Part C system folks, both the community center boards as well as the providers, very much engaged in your efforts. How about the rest of you? Are there other folks that you've engaged who are perhaps not the usual suspects, but as we think systemically, this point about thinking systemically about implementation, so where are all the different providers and agencies and systems and community connections to these young children? Who are all of those people, and how do you get them engaged in this effort?
In Larimer County, we have school districts, early childhood programs involved. I don't know if anybody's mentioned that yet.
Well, and Mary is glad to hear about that, right, Mary?
Oh, this is Mary. I'm sorry.
Oh, that is Mary. Okay.
Yep. Sorry.
I can't see you.
I know.
Yeah, so, making sure that the school district programs, sometimes in some places, the only ones who are receiving funding.
Right.
CPP or children who are involved with Part B special education.
Right.
Really important partners.
This is Cheryl from Northeast Rural Resort region, and I'm not on the call. I'm on the call, but I haven't been able to register for the call because I'm having some IT difficulties. We are in the beginning stages of a leadership team, and we have our, and maybe this has been mentioned, the Head Start Director for Summit County and also the Colorado Mountain College, some instructors who will hopefully teach the pyramid as ECE 237 in the fall.
Excellent. Chris, does that sound familiar to you?
Sounds very familiar, yes.
Yeah, that's terrific, Cheryl. So, yeah, be thinking about how to engage higher ed people who are teaching these early childhood courses either in community colleges or in four-year college programs. Very important, as well as Head Start. Really important partners. Chris, would you want to update kind of on where things are since you started implementing last year?
Sure. We are in what we're calling our second cohort of group going through the pyramid training. We have it as ECE 237 in our local Pikes Peak Community College and are offering the class for 3 credit hours. And then we also have a coach mentor. The instructor and the coach mentor are one and the same persons this year, who then does individualized coaching and mentoring in the sites. We are able to scholarship folks for taking the class through Pikes Peak Community College through our local Department of Human Services and CCAP Quality Enhancement Funds. So last year we took people from approximately 12 different centers and had about 30 people in the class. This year we're only taking people from 5 centers and have 20 people in the class. We're trying to embed it more into the culture of the center by limiting the number of centers that are involved and asking that they send at least half of their staff and train half of their staff. But we did a pre-test and we did a pre-TPOD or the Tippy Toes in every classroom that's participating, and we will do a post-Tippy Toes in June, or in TPOD.
Yeah, terrific. So it sounds like you've given some thought, Chris, to what the critical mass is in those programs for program-wide implementation.
Correct.
Yeah. another thing to really think about when we get to that slide.
Last year, we were hoping that there would be more of folks from the centers going back and training the others in their centers, and that just really did not happen the way we wanted it to. And so this year, we're just trying to train more people within the centers.
I see. Makes sense. Well, and with the experience you've had as we go through these other slides, I think it might be helpful for you to just share, because in the 237 class last year, you really did try to have both an administrator come to the class as well as a person who could be in the role of trainer. And even with just 2 people coming from a center really wasn't enough of a critical mass to keep that training going.
That's right. And we did make the same requirement this year that at least one of the persons in the team that attends from a center is the director or the assistant director. And then in most sites, we have almost half of the staff participating.
This is Rob Corso. I would add sort of lessons learned from school-wide PBS here of getting to what that tipping point seems to be of 80% of staff at least bought into the initiative. And we have more work now, doing some pre-surveying, if you will, of staff of are you on board with the hoped for outcomes of the initiative, even if you don't understand the strategies yet or we're not into the training or coaching around it. But making sure there's enough critical mass behind it that beyond administrative support that the likelihood that it will take hold, it seems to be that number.
Thank you, Rob, for sharing that, and thanks for joining us. And I'm noticing that we also have Darcy on the call. Good morning, Darcy.
Morning, Lori.
So jump in if you have anything to add. We're actually just talking right now about people on the leadership team. So does anybody else have anything more to add about just sort of some lessons learned with you and putting together your leadership team?
Go
ahead.
Okay, this is Cindy, and one of the lessons we've learned so far, even though we're just new into this, is that it's critical, because our leadership team comes from a variety of different agencies throughout the community, that there's clear communication and that everybody is following the same kind of protocol when people are approaching us, when we're out in the community and we're spreading the word, that everybody gets that information so no one feels that they've been left out or that one team member might be making promises for the team that the other team members don't know about, or whatever can come up. Clear communication, we've found, is probably one of the most important pieces. So we're in the process of trying to design and develop some protocols around that.
This is Virginia, and in Norwood we started out with more of a community-wide or regional leadership team, like with the Director of Special Ed from the BOCES and the Director of the Early Childhood Council and the center and service providers and the school superintendent. And what we've found over time now that this site is actually certifying, that we've just recently gone to a tiered approach with our leadership team. So there's still the general team that I just described, and so they're meeting for an hour monthly, and then for an hour and a half monthly are the people who are on the site who are more directly involved, because we didn't want to lose contact with the community people. But as we started to certify, we realized that the meetings needed to be more focused on what was happening at the site. And this is a town that doesn't have a local early childhood council. So the bigger leadership team was kind of keeping track of what's going on in general in early childhood, as well as the pyramid model. And now the second tier, the more site-specific team is working just on the site.
Mm-hmm. Yeah. I guess
So that's what we found is over time, as our goals became more specific, we needed to be more strategic about our meetings. So I just thought I'd share that.
Yeah, and what we really do see is the necessity of a leadership team that is focused on the community-wide goals and action steps. And then we also want to see leadership at the program level. So it makes some sense, Virginia, what you're saying in terms of that group really getting things going. But then when you have to really concentrate in your own program on program-wide fidelity implementation, that takes a lot of concentration and time. So yeah, there have to be lots of layers here. So it's interesting to think about a tiered approach and where the leadership teams are working kind of within a tiered approach here to implementation. But to Cindy's point too, the importance of communication, also having the leadership team really establish a clear mission and purpose for what their role and job is, and that this then becomes their communication strategy out to the community. So very important. Anything else about that, about leadership team? Otherwise, we could move on and talk a bit more about community buy-in. When you get the community-wide benchmarks, you'll see this is more appropriately labeled communication and visibility. But it becomes an important role and some action steps the leadership team needs to take about how it's going to communicate with the community. I'm just wondering if any of you have awareness activities that you've done that have worked really well.
This is Angela in Adams. We are doing a little bit of a different approach, I think, than some of the other communities in that we're putting the Incredible Years into all of our school district and Head Start preschools, and we're doing more CEFL general pyramid kind of things for child care centers that are unable to do the Incredible Years because of how intensive it is. We've been, so we're doing a lot of work to kind of make all of that fit into a continuum approach for our community. But one thing that we've been able to do with the Incredible Years, and we're working toward doing with general pyramid type activities, is communicating the outcomes that we're seeing. And that has just done an enormous positive things in our community in that we have a lot of different meetings with school superintendents or police chiefs or different kinds of leaders in the community, and they've really been grateful about what we're able to tell them about what the positive things that are happening for kids, and it's really turned the tide in that a lot of people are now talking about early childhood social emotional. You know, I think if you don't have the outcomes, then it's a little bit harder to do the awareness, but it's been very convincing to use that data.
What kinds of outcomes are you sharing, Angela? Angela, what kinds of outcomes are you sharing?
Oh, I'm sorry, I didn't hear your whole question. What we have right now is information from the social competence scale for the Incredible Years. So we have information on about 2,000 kids in our community that are going through that program that we're able to compile, and you know, those are self-regulation, verbalizing feelings, those kind of things. And as we've been working to structure an evaluation plan for our mental health consultation and our CEFL activities, we're really being attentive to the alignments there so that we can speak more broadly about outcomes in the community. So we don't have anything at this point that we're able to share about CEFL because we're so new to the pyramid, and we certainly don't have any sites yet really implementing it with fidelity or program-wide. We're just starting to kind of chip away at that iceberg. But we hope to get there, you know, and the success with the Incredible Years will definitely inform what we do with awareness with regard to the other pyramid-type programs and approaches in early care and education settings. So.
Thank you. Are any of the rest of you using data as part of your community message? Creating awareness, creating sort of a sense of urgency and need?
This is Cindy, and the way that we decided to work on this, the pyramid model as well as the early childhood mental health more intentionally was because of some data that we collected from community surveys. We did 3 community surveys, one with early childhood professionals, one with parents, and one with community business people. And we did all of those, collected the data, and the results was very interesting because it came back that early childhood mental health was a huge need, although we didn't really label it early childhood mental health because, especially for the parent survey, we didn't want to scare them off because it has such a negative connotation until we had a chance to really help them understand that everyone has mental health as a part of their being, and that we just want to make sure all children have positive mental health growth and development, and that we weren't saying your child has mental health issues that we need to provide treatment for.
Cindy, what was the first one that you, the survey was for? You had parents, business people, and what was the first one?
Early childhood professionals, the providers that work with that population. And that didn't include just the typical early childhood providers, but it also included those other people that we don't always think about, like the R&R folks, the early childhood mental health people that work with that population. So we broadened that a little bit because we wanted to try to make sure we captured as best we could anyone and everyone that was working with young children.
School nurse?
Yes. And we don't have a lot of those, but we went to our health department, and so we have a lot of our mental health consultants working through the health department, and so, yeah, we did them as well.
Okay.
Would it be helpful to people to possibly ask Cindy if she could share the surveys?
Sure. I've already shared with a couple councils, but I'd be happy to shoot that out.
Absolutely.
The other couple of things I'm thinking about is that, and Connie, I don't know how you might be able to assist us here, but you know, there is statewide data from the Children's Health, what is it called?
Child Health Survey.
The Child Health Survey.
Right.
That has some specific questions that parents answer about concerns about social emotional development. Now this may also go into the next slide, which is going to be about family involvement. But in terms of creating sort of buy-in from families, that is data that, as far as I understand, can you go to the health department website, Connie, and pull down that data from your particular county?
You know, there's a couple of options. On everybody's flash drive when they attended this first round of the summit, they have that data as well as the link. And it is grouped by, I think it's called Colorado Statistical Regions, where to have valid data, some of the counties, particularly the small ones, are grouped together. So it may not be available per county. It may be a collection of counties, but for those councils who are interested in getting that information by council, let me know. We can put forth a request to the Health Statistics Department and see what is available for some baseline data. This data, as Lori was talking about, is a telephone survey, so it is information based on parents' perception or information, but at this point in time, that is what we are using as statewide data to show some changes in services and parents being satisfied with what's available to them.
And then the other piece of data that I would mention is we euphemistically called it the Children with Challenging Behavior Survey that was done 3 or 4 years ago for the previous Early Childhood School Readiness Commission. And some of you might even remember having received that survey. It was sent to over 6,000 of the people who are on the Qualistar licensed provider list. And it was a fairly robust survey that gave a lot of really interesting information. Sarah Hoover still has access to that data, which can be accessed by zip code. So again, if you're wanting to look at some baseline provider information from just a couple of years ago, specific to provider needs related to social emotional development, it's another place where there is some data to use as you focus in on your goals, as you maybe want to start talking with your community about needs.
Lori, just before we leave the community, spreading the word around the community, in the San Luis Valley, one thing they did is their Early Childhood Council has an annual conference. And so they made all of the mini trainings in the conference around the pyramid model. And they weren't necessarily like teaching the specific skills, but introducing the idea of what is emotional literacy. And here are some general things you can do to build emotional literacy, or how do you talk to children without asking so many questions, or self-calming techniques, that sort of thing. And so that way when the teachers heard about it more the following year, or their sites might be considering it, at least they had some familiarity with the concepts.
Right. So it's preparing people for that readiness for more information. That's good. Yeah. Moving on, if we could, to family involvement. So how many of you have families on your leadership team?
We do.
Good. Who said that?
Virginia.
Good. So want to be thinking about who, the sort of parent involvement at all levels of this. And in the community, who are those parent leaders that are really critical not only to advising us as we move ahead, to ensure that we're sort of always thinking from a family perspective about what matters to them, what's going to work for them, but then also providing the leadership back to families to keep them engaged in the efforts. Any of you have other strategies for involving families?
Well, I think back to the awareness piece across the community, and in this case across families, just offering the positive solutions for families training, to the parents at the centers and sites really moves that along. And personally, I think we just recently have added families, and we've been meeting for a year. And I know that's not necessarily what the model suggests, but we kind of felt like we had to get our feet underneath us a bit. So, we weren't still just assembling the parts of the airplane when the family arrived. So that's just how we chose to do it.
Yeah. So be thinking about how to communicate your efforts to families, including families and training opportunities. I know in Pueblo, isn't it true, Cindy, that you've had a lot of families involved in the community trainings that you've been doing? Primarily through Head Start, is that right?
Yes, and we've really reached out to them, and part of our community awareness was our resource sharing day that we have every year. This year we did focus on early childhood mental health and the pyramid model in particular. And of course, Lori was our keynote, but we did invite a lot of those families, and that's part of the beauty of having our CASA coordinator participate as well. A lot of those volunteer. She works with our family members or works with family members, and they're able to share the story and give them some strategies to use. So we open it up, all of our trainings, to the entire community, which includes families, and we really encourage those programs that are participating to do the Model to Fidelity to invite their parents. And we've had a fairly good response. As we all know, parents are really busy, and so we don't get them in the hundreds, but we certainly get, a few here and there, which for us is pretty good.
So terrific. Anyone else want to share anything else going on with families that has brought them into your efforts? All right, let's move on then to sort of what then to expect from the programs that get involved with community implementation. And this really would have to do with how you might establish some criteria for choosing programs who are going to be involved, what it means to be a demonstration site, and how we determine the level of fidelity so that people who may go and visit can actually see the pyramid model in practice in demonstration sites, and perhaps kind of a plan to roll out sites over time. But I'm wondering how you all are thinking about choosing and involving community programs in your efforts. Who hasn't talked for a while? There are several people out there very quiet. Debbie, can you talk about this?
We really have not gotten any programs on that yet.
Okay.
We're trying to, I guess we're not quite there.
All right. Who has recruited programs, and what has been your strategy to do that?
This is Cindy. We've recruited 8 different programs so far. We started with 4, and the way they're we selected them is based on funding sources. The first 4 are funded through the SSUF funding that came through the state. That funding is housed at our local mental health agency, and the council is a strong partnership with that. And so we selected 4 sites. Then the way we did it was we sent out information letting them know we were looking at doing this, giving them a brief overview. And then we've done a couple of overview trainings in the community, short 3-hour trainings of what it's about, how it can benefit, some fun activities, kinds of things. And then, of course, we did our really big community event, our Resource Sharing Day in February, to really kick it off. That was our official kickoff. And then we followed it up with once we had people that attended that or couldn't attend because the day didn't work for them, then we had a follow-up a few weeks later on a Saturday morning for 3 hours that kind of summarized that whole day event. And so I think the more information you can give programs, the more likely they are to say, wow, yeah, this is something I really want to participate in. And so with our second go-round with a different funding source, which is the Colorado Trust, we put that out there again, and we added our 4 additional sites. And so because it does take money, it doesn't come free. If you're going to really do it to fidelity and have those professionals, those coaches and trainers out there doing what we need to have done in order for them to be successful using the model to fidelity.
So I don't know, Rob, if you or Darcy want to chime in here, but I think this is where we've learned a lot here in Colorado about what it takes, as Cindy says, to get to fidelity. In the early days, we did module training and trained up, close to 400 people in Colorado in the preschool modules. And what we found was people went away very excited, but we really were not sure we got much implementation out of doing things that way. And so communities thinking about a community-wide implementation may really want to think about the two different approaches, broadcasting the training seeds broadly and see how they start growing, or really focus on, and I think, Chris, you had some thoughts about this from your experience last year, but really concentrating resources and building programs to a program-wide fidelity that can sustain themselves and perhaps also have a hand in supporting the next program over. But really doing so with dedicating resources for training and then follow-up coaching to fewer sites that then become your model demonstration sites. So two different approaches. Rob, I'm wondering if you have any.
Yeah, I would probably take the word "or" out there and put "and" in there. I think there's a need to always do the awareness level stuff so that there's a next cohort of programs that may be primed to do deeper implementation of program-wide. But certainly, we've tried to define kind of readiness criteria here of things like leadership team, administrative buy-in, ability to commit resources, making a 2 to 3 year commitment to the process, having identified coaches involved, and really the benchmarks of quality being kind of the roadmap of what steps to take for implementation. But I think it's probably a both and, where we need to be doing that leadership support for those programs that are ready to do deep implementation, as well as know that we're going to have those hour-long awareness sessions for folks to build interest for those who might follow. In California, we are using that mentor approach that you alluded to, Lori, too, where demonstration sites in community-wide implementation are not only agreeing to do deep implementation, but when the time is right to be able to mentor another program along. And I think there's some programs, some settings that are never going to be able to do this alone, and that if we're going to reach into the hardest to reach settings in child care, particularly home-based child care, there's different levels of partnerships that need to be made than the program-wide model.
Lori, this is Debbie up in Weld. And, I think early on we had tried to have some training specifically for center directors, and with the idea that then the director was going to coach and implement training with the staff. Mm-hmm. But what we found is that it just really hasn't been happening. Mm-hmm. And so that's where I'm kind of feeling like we're coming back to the drawing board in a sense and just saying, well, that didn't work, so now how are we going to implement that? And that's where we've been working on creating the training specifically for coaches, helping them to understand, so that we've got some specific language that's true across any coaching initiative that we have, any of the projects that we have that require coaches, that the pyramid will be part of that coaching that's going to be happening as well, regardless of the other form of purpose that they're in there.
I see. So have others had the experience of administrators perhaps not being the ones who can actually implement? We know that they are critical in terms of support, in buy-in and leadership, but maybe not the folks who are, and it may not be because they don't want to. It could be just competing responsibilities and not enough time, I don't know. But have other of you had that experience with administrators? I think, Chris, with the Alliance last year, what I remember about that was the administrators got really excited about the information, but you also had them participating in the college course as a team with a person who then could be their primary implementer. At least that was the strategy at the time.
Right, right.
And we found that that didn't even really get to it because it didn't get to what Rob was saying about getting 80% of the staff.
No, and we just all know that when you get back to the center, life gets in the way, and that time set up for taking that training to the next level and to the rest of the staff just doesn't necessarily happen.
Yeah.
Which is why we tried to go with greater numbers from the same organization this year.
Right.
And then in response to your kind of initial question, when we recruit, we actually have centers fill out a site application, and then we also require individual applications from all of the staff who choose to participate from that site.
And what were you looking for, Chris? How did you choose both the staff who came as well as the program sites?
One of the things that we were looking for in programs were those that had really participated in some sort of quality improvement project in the past, because we wanted them to have some sort of readiness for implementing new ideas. We were not looking at centers that their primary goal at this point in time was to keep the lights on, because we thought we had a better opportunity for implementation if they were established, had been involved in prior learning experiences, had been involved in implementing other programs. So that was one of the criteria with them. We also had been hopeful that they participated in other outcome, doing outcomes and assessments with children, that they participated in making referrals to mental health, or what they were doing. So we just really looked for some overall information from the centers as to where they were and how they were doing the running of their programs. We also, because of the funding source, like Cindy had mentioned before, we did require that the majority of our centers be CCAP accepting sites, because we were then going to be able to scholarship them. From the individuals, we were looking for people primarily who already had their group leader qualifications, and for whom this was not going to be one of those other classes that they could use for that, simply because we wanted them to have a certain level of expertise already.
That's helpful. Yeah. Anybody have any questions for Chris or Cindy or Debbie about their experience? Okay. Well, let's move on then to the next slide, really talking about for training, teaching, and coaching, and what are the expectations for your folks who are going to be your primary implementers. So one of the things that I've mentioned and really would encourage you all to think seriously about is having your implementers go through the certification process. As a trainer, a coach, or a trainer and a coach, we really believe here that sustainability and fidelity are given a much better chance when you have local certified people. So again, I'm really happy taking any questions or any further information that you may need from me offline. So just email me if you do need more information about certification. But again, I think we all are really interested in fidelity implementation, and really the way we're measuring that is to get to 90% on the teapot or the tippy toes for what we're seeing in those teachers' behavior and in the way the classroom and the environments are set up. That's the way we're measuring that.
Lori?
Yeah.
I'm sorry. This is Debbie and Weld again. Now, we do have two of our community people that are going to be certified as trainers, but I guess I was not realizing that there was also certification for coaches, and so I do have more questions about that.
Yeah. It's two separate processes. The skills really are very different in a coach and a trainer, as well as the activities each are engaged with are quite different. And so our certification process really is individualized for both sets of people. But you're right, you will have two certified trainers for Weld County. And I can send you more information if you'd like, Debbie, about the coach certification.
Yes, I would like that, please.
I'm just wondering if you all would like to have that information, people who are on this call.
Yes, that would be helpful.
Okay. Can send that out. Anything else that we need to talk about, or Rob and Darcy, do you have anything you want to add about kind of the getting people trained and coached and those expectations to be thought about within the leadership team?
Nothing more I would add. I like the idea, though, of kind of getting that commitment from the leadership team, not just the administrator. I thought that was a great idea.
Okay. We've already talked quite a bit about the plan for program implementation, and again, the benchmarks that I sent you were the program-wide ones. I'm going to be sending out the community-wide ones, so these things are a little bit different. And probably will be a bit more the vantage point where you are all sitting. Would like to move on, though, to having you consider some conversation to be had at the leadership team about the agreements that you're going to be making with your partners for community-wide implementation. We're pretty strong on helping people get to the point that they have the skills to manage all children in their program and really want to get to a place where people can agree to not expel children. Our concern about children who end up in a situation where they're excused or expelled from programs is it's a pretty dismal trajectory for those children. So we're all about building the capacity where that just doesn't need to happen. And something that might be a goal of leadership teams. Have you seen that, Rob, where people actually build that into their agreements?
Yeah, absolutely, for sure.
So, and then in order to not expel children, make sure that, people in the community know where they can get the support they need to be able to keep kids. And then thinking also about aligned philosophies on inclusion and working very hard to have programs that include all children. But are your leadership teams beginning to consider these kinds of agreements? I know, Cindy, we've had some conversation in Pueblo about how to engage some of the programs that you're working with on sort of an agreement level about some of these things.
Mm-hmm.
And it's probably a process of doing so.
It is, and because, as I said, we're building it kind of as we go, it would have been nice to have some of these protocols in place going in with programs, but we didn't know what we didn't know. And so now we're kind of going back and trying to develop some of those and then talk with programs as to how can we make this happen with and still keep them engaged in the project without them feeling like, oh, well, if I can't ask a family or a child to leave, then I just won't participate. Because that doesn't benefit us or the programs or the children and families most of all either. So we want to make sure that we're sensitive to program needs and really educate them about why it's not good to expel a child from preschool. It's just, there's a multitude of reasons, and I'm sure everyone on the phone understands what that does to a child's self-esteem as well as a parent's position of trust in the system. So we're kind of trying to build that now. We're trying to educate programs and give them some strategies and opportunities so that hopefully they don't get to a point with a child that they feel they just need to ask them to leave.
Yeah. Yeah, it probably is more of a goal.
Yeah, I agree. I think it's really hard to just start there for most programs. I think for programs that have resources and have access to mental health consultants and a great deal of expertise at the top of the pyramid, and starting there is probably more realistic. For other programs where we have so much work to do at the base and the middle of the pyramid before we even get to intensively understanding how to support kids at the top of the pyramid. I have definitely seen programs reach a cracking point or dangerous point because they're keeping kids in they probably historically would have been asked to leave and don't have resources or expertise yet to support them successfully or support the caregivers successfully. So I think it is a hard one to just blanket-wise say, everybody needs to agree for no expulsion right from the get-go.
And again, sort of back to Angela's point earlier, it may be part of the community awareness message to the providers, just engaging them in information which we can help provide you with about the trajectory of these children once they are programmed. So, it could be part of the whole community awareness piece, but definitely something to aim for with your community-wide implementation. Anything else about agreements? Are you establishing signed agreements with your community programs?
Lori, this is Virginia. In the San Luis Valley, they did establish MOUs with each of the sites, and I'd be happy to send that to you if it might be helpful for other people just to look those over, and maybe then they could use it in some ways for their own programs.
Sure. Would that be helpful?
Virginia, this is Sharon from Elbert County. Who did you establish the MOUs with?
This is in the San Luis Valley, and they were with each of the sites that rolled out in the first year. Okay. And now they're rolling out their second set of sites. So actually I'm going to a meeting on Monday, and they're going to be redoing the MOUs. So I'll wait and send the newer version out so you'll have like what they learned in year one taken care of.
Very good.
That would be helpful, Virginia. And perhaps anybody else who has samples of signed agreements, what sort of each party's responsibilities are as they're specified in an MOU or an agreement. If you want to send them to me, that would be great, and I can also get them on to Connie.
Great.
Okay, well, you know, we've talked some about professional development and staff support. Talked a bit about funding and the importance of having a longer range funding plan so that this work doesn't become sort of another flavor of the month, but really can be sustained over time. Really liked what Angela was sharing with us about working hard to be inclusive of incredible years as well as the pyramid model work. And if, for those of you who know, there's quite a lot of consistency between the two models. Certainly some of the pyramid model strategies come directly from Incredible Years. So, and then again, I think Incredible Years would say that they have a special fit within the pyramid model, primarily related to targeted strategies. So there's still room for additional work in other parts of the pyramid, even if there is full-on implementation of the Incredible Years. But any other thoughts or ideas about professional development and staff support? All right, well, I'm going to move this along. We definitely think that monitoring the implementation and outcomes is hugely important. Those of you using Colorado Trust dollars for some of this know that it's a major requirement for that money, as well as any money these days has got to be tied to showing how it's producing outcomes for kids. I took actually these bullets directly from the Colorado Health Trust, Colorado Health Grants. Is that what they're called? Colorado Trust Health Grants, where they are really built on the Colorado framework out of the Lieutenant Governor's office, where we do have a couple of very specific outcomes that relate to the pyramid model work. But anybody else have any other thoughts about your evaluation plans? Are you all considering what your evaluation plan is as you're going into the community-wide piece of things? Really want you to be focused on child outcomes, holding your team responsible for outcomes resulting from the action plans that you're putting together. Really looking at how you then are measuring implementation. Are you using teapots and tippy toes? Are you going to use the benchmark of quality as a way of just tracking the work you're doing in your leadership team? So the tools that I send out today that Rob was good enough to get to me are really tools that you can use to measure your outcomes as a community team. Rob, is there anything else you would want to share about that?
I guess I just add the importance of kind of knowing what you want to measure before just implementing the tools, so you know what kind of analysis you want to do and what you have capacity to do. Particularly for community-wide, I think it's important to be thoughtful around what are the expenses of gathering data, managing the data, analyzing the data, reporting on the data, and I think for places where we've had larger implementation, it has really meant kind of being strategic around a sampling approach. So you're not overwhelmed with data that you can't use because you can't handle that much raw data coming in, or the expenses are just prohibitive in terms of costs for particularly the administration of child level tools.
Good advice. Okay.
And I guess one more point I'd add, if communities are working on that framework, in a lot of these, we're all trying to discover the same thing. So I certainly have logic models or other types of written outcomes. If folks are engaged in the evaluation piece, I would be happy to share some resources.
Excellent. Does that sound useful to people to get some of Rob's resources around evaluation?
Yes.
Okay.
Yes, that would be helpful, I think.
This is Connie. And Rob, I think listening last week when we were up in Larimer, hearing the possibility of linking with higher education, specifically CSU, and looking at this vast amount of data really has the potential to open up some great doors and strong relationships.
Yeah, we're fortunate in Larimer County to have CSU. I think finding those folks who can assist with the data piece has been for not just communities, but for the states that we're engaged with have been somewhat successful. It's obviously easier to get a product out if you have dollars associated and real resources behind the evaluation. That's particularly challenging for programming communities to come up with substantial amount of dollars to put behind an evaluation. But reaching into the community like we can here with CSU, Maryland the state of Maryland has reached into the University of Maryland. I think those that's been somewhat successful strategies for folks who have expertise to handle data and also have their own research interests. That kind of gets the win-win there.
Well, and Rob, I think we're going to want to stay in communication because UCD is also building a data system to collect information about implementation. So we're going to want to have UCD and CSU talking to each other as well.
Yeah, and the Iowa Department of Education has just made all of this web-based. I think if we're going to want to go to scale and aggregate across the state, it has another level of implications, and I'm real excited about what I think Iowa is going to be able to share here shortly about how you do this and not just collect it on a program level or a singular community level, but aggregate across communities. Obviously has its major challenges here about again, sheer quantities of data as well as consistency of what types of data are being collected to be able to say anything meaningful on a state level.
Yeah, and this is Angela from Adams, and I would just say as we've been really trying to put together an evaluation plan that is sensitive to the requirements of all these different programs, including the Incredible Years, including CEFL Pyramid and mental health consultation, and then, the different types, the different funding sources for mental health consultations, I'm sure the other council coordinators are aware, have different evaluation requirements, that really juggling all of that at a local level is has been quite a task. And we really put 6 months of work into thinking about what is most meaningful to be gathering and how can we combine or simplify the methods of gathering it so that we're not being telling sites that are participating maybe in multiple aspects of this social emotional work that they have to fill out 3 different things.
Take a paper with you.
And I would just encourage, as maybe the CSU and the DU work moves forward, that they maybe talk to some councils that are doing this around how we've maybe managed to align a little bit of that with mental health consultation and Incredible Years, because it just seems like a common challenge that communities will be in. So that's just my 2 cents.
I think that's a really good idea, Angela. And Rob, what I'm wondering is maybe after the Iowa information comes out, maybe we could even host another webinar just about evaluation and thinking through evaluation.
I think it's a great idea, and that, that 6 months, Angela, that you're referring to, getting that framework down, getting that, what do we really hope, there's so many interesting things to ask, but we can't ask it all. What's the most essential? And unless we can turn around the data in a timely format so that, those who are completing the data get some benefit from it, then of course we get a little bit of initial buy-in, and then if it takes 4 months to turn around a chart or a graph, and it's no longer timely data coming back to the caregiver who completed it, there's just not a lot of motivation for folks to continue doing the data collection. So lots of lessons learned that I'm sure we all could share here, and I think it would be a great future discussion here on evaluation strategies and approaches.
Right, because there's real results matter alignments as well. Yeah. And that's something that we have not even begun to tackle or think about because it gives us all a headache. But there's just a lot of data out there, and as much as if we start moving forward with evaluation and kind of like a alignment, sort of simplifying and combining different data sources across silos, I think we'll all be better off, rather than trying to do one evaluation for one program separate from everything else.
And bringing in folks from other states is certainly possible. Nebraska's results matters. It brought Lisa Fox in to talk about that merge already about 12 months ago. So I think there's some states grappling with the exact same issues, and if we wanted to bring some folks in from Iowa or from Nebraska or just keep it internal, I think there's lots of similarities that and lessons learned that I think we can glean from each other.
This is Virginia, and the San Luis Valley's looking at how they're going to use their results matter data within each site. So I can share that with Lori, and she can send it out as they get that figured out.
Terrific. I think we ought to think about doing another webinar, and maybe, what would you say, Rob, sometime a couple months from now, where we could really focus it on the evaluation questions and beginning to try to make this more sensible and more integrated than it currently is.
I am happy to be a part of that. As long as you don't expect me to have all the answers, I am happy to struggle alongside everybody.
You probably have a lot of the questions.
Oh, I got a lot of questions, that's for sure.
So here's another question for you, and then we're going to start to wrap up if it's all right. So people, think about whether you have any burning questions to ask before we're done. But Connie had a question, Rob, that I think you can best answer, and the question is about sharing the new community benchmarks documents with the statewide early childhood system, or is it better to share it as part of a discussion? So, the ECLA group meets on what is it, you guys, a monthly basis?
Every other month.
Every other month basis. So I think the question is, how, Rob, would you suggest is the best use of the new community benchmark document?
I probably need to get Lisa Fox in the mix a little bit to see how much she's ready to let it go, and if she's open to it being out there. It is hot off the press. It really is something that just in the last few months we've really seen the need for, as we have more and more folks thinking about this as community, and I think that's the right way to think about it, is our kids, not a singular systems kids, a special ed kid, a Head Start kid, whatever. But that that tool has come out of University of South Florida and is still in draft stage here. So I think probably, Lori, I need to do one more level of spiraling back to Lisa to see how much she's ready to let go of it versus just know that there's kind of drafts floating around there for folks to reflect on and give input into still.
Okay. Well, you know, when you do talk with her, Rob, you might let her know that we have probably at least 12 communities on this call today, so that these are communities who are very interested in implementation. And if she wanted a group of people who might be willing to give some feedback on it too, since we've had it as a part of our discussion today, maybe she would be interested in more.
Yeah. If Colorado has played that role for CEFL for 5 years now, if you all don't mind both, having tools and giving feedback on them simultaneously, I think that she might be really open to getting some input from real communities trying to use the tool.
Yeah. So for now, Connie, why don't we just kind of contain it to the group that's been on this call?
I'm absolutely fine with that.
Yeah, waiting more information from Rob and Lisa.
I want to make one other comment, and it was back to the evaluation, and I'm thrilled that this will be a follow-up call. And I think not only sharing with those councils who have begun implementing, but for those councils who are thinking about it, and what does it take to get the necessary data, and what is it going to look like from a state perspective of ensuring that we get the best information to really showcase what the state is doing. I think that's an excellent next step, so kudos for thinking about that.
Good. Any last questions, burning questions?
I'm sorry, this is Rob. I got to run. I'm facilitating another call that starts right now. So
all right, thanks,
Rob. Look
Rob.
forward to continuing the conversation.
All right, thank you for joining us.
Bye, everyone.
Bye. So I will follow up with you all and get you out the information that we've talked about today. I think Connie and I certainly would be very interested in providing any other individualized support that would be useful to you all. I would like to just mention to you that we will have some additional spots available in our Summer Institute for community teams. The Summer Institute was primarily designed for people going through certification. There will be two parts to the Summer Institute. One is Glenn Dunlap is coming in to do a day and a half on intensive interventions for children with challenging behavior. And then both Mary Louise and Lisa Fox are coming to do 2 days on program-wide implementation. That'll be in Breckenridge in July. And then the fall training is a second part that community teams could consider coming to, and that will be that will include a day and a half with really focused on building blocks and strategies for inclusion in classrooms and the building blocks approach. There will be a policy institute and a celebration one evening, and then we're also going to have a day of special quest training during the October fall training. So I just wanted to mention that to you, and when we have the information to go out to teams to register, I'll make sure that all of you on the call get that information. We will have preschool module training coming up in Crested Butte in August, so anyone in your community that wants the full-on preschool module training, that will be available. And then we're doing the infant toddler module training in November. All of the spots that start tomorrow are already filled, so those will be the next module trainings. Any of you who are connected with resource and referral agencies, if you are interested in trainings that we're doing there, Johanna Wasser is your contact. And then again, I want to mention all of our training information is on our website, www.pyramidplus.org. So that's where you can get a lot of this information as well. Two really quick last things I want to mention is that there are 2 other webinars that are scheduled. Barbara Smith is doing one called Making Decisions Together, and this is really going to be focused on building teams, and that'll be on May 6th at 12:30 in the afternoon, and that information is on the website or will be. And then there's a Special Quest webinar on the 25th of May at 12:30, and if you're interested in that, the contact for that is Holly Wilcher. So.
Hey, Lori, I'm not seeing on your slides those last 2 offerings. Was it listed?
No, they're not on there. I'm mentioning them now to promote your interest and to suggest you go to the website.
Perfect. Thanks.
Because they are not on this slide.
I thought maybe the system stopped.
Yeah, no, I couldn't fit it all there. And then here is our address, and for any of you needing to contact me, my email address is down there at the end.
Lori, this is Virginia, and I just wanted to say that for communities who are just starting to roll out or thinking about rolling out, I think these trainings that Johanna is doing for, Johanna and Kelly are doing for the R&Rs, which are about the environment and the relationship, which I've not attended them yet, but I think that would be an awesome way to do like a general introduction and really encourage lots of players in your community, daycare providers and preschool teachers and agency folks to come out for those.
Yeah, that's great, Virginia. I'm glad you said that. So we really are offering those through the R&Rs. So Cheryl, I don't know if you've thought about doing one where you are, but we are providing those free of charge, and we're able to do 8 this year. So again, Johanna is the one on our staff who's organizing those.
Thank you.
Okay. Hey, you guys. It's been a great conversation with you. I hope this has been helpful. And I will send out the information promised as well as an evaluation for this. And if you would fill that out and get it back to me, I'd appreciate it.
Okay, thank you, Lori.
All right.
Lori.
Thank you all.
Thank
Have
you.
a good day.
You too.
Sure. Alrighty. Bye-bye.
Bye-bye.
Thank you. Please stand by.